Hello guys and welcome to my channel. So in this video we'll be discussing dental amalgam. So what is dental amalgam? Dental amalgam is a metallic restoration which consists of mercury mixed with metal alloys such as, or these alloys can be made of silver, tin, copper, zinc, among others. We can even have noble metals such as palladium and indium mixed in there. So generally, what you need to know about dental amalgam is mercury, which is usually liquid, is a liquid metal mixed with an alloy. And I mentioned a few of the metals used in this alloy. And mind you, the alloy is usually in the powdered form. So we have mercury liquid, alloy powder, and these two mixed together give you your dental amalgam. And it usually gives you a plastic mix which you can mold or you can manipulate into your cavity and generally sets about 3 minutes. So the history of dental amalgam. What is the history behind dental amalgam? Louis Regnat is also known as, or he's known as the father of amalgam. He discovered the use of mercury in the mixture, the use of mercury in dental amalgam. And of course, mercury is a very important component of amalgam. So he's called the father of amalgam because he came up with the use of mercury. And he initially came up with the use of mercury to lower the temperature of the reaction, right? The next is GV Black. In 1895, he came up with a dental formula or dental amalgam formula for the most clinically acceptable performance. So if you want a good clinical performance of your amalgam, the ratio you should use or the formula, he came up with it. And of course, J.V. Black is also known as the father of operative dentistry. Then Dr. Wilmer Ames, he came up initially the mercury to amalgam ratio was 8:5, but he he thought of reducing it, or he reduced it to a 1:1 ratio. And the reason why he did that was because he wanted little or no mercury left unreacted because mercury is toxic. The next thing we need to know about dental amalgam are the properties of dental amalgam. So dimensional change. Dental amalgam or mixing undergoes in an initial form of contraction, and then it undergoes expansion due to crystallization. So we have initial contraction and then expansion. It, it also under it also undergoes microscopic expansion, which is expansion due to corrosion. That usually happens after it has set. It has high strength. It has a compressive strength of about 80 megapascals, but of course, this figure is not fixed. It depends on the type of amalgam you're using. It also undergoes creep, and creep is plastic deformation under load. It's a time-dependent property. And the best way to understand creep is think of potholes on a road, which are usually filled with asphalt. They are overfilled at first, but as time goes on, it tends to level out. That is due to creep, and we don't want our material undergoing creep, but it's a property of dental amalgam. It undergoes corrosion, which is a reaction that involves the bulk of your dental amalgam, and it also undergoes tarnish. Tarnish, the tarnish is a reaction that involves the surface of your material, and due to this, or due to its ability to undergo tarnish, it actually gives it a good marginal seal, right? It gives it a good marginal seal, and also biocompatibility. Now, the biocompatibility of dental amalgam is still under debate. There are two schools of thoughts. Others believe dental amalgam is toxic because of the use of mercury, and other schools of thought also believe that the release of mercury from dental amalgam is too little to actually cause a patient any harm. Next is thermal conductivity. Of course, it's a metal, so it has a high thermal conductivity, and also CTE, which is the coefficient of thermal expansion. And the coefficient of thermal expansion for dental amalgam is 3 times that of dentine. And it's because of this property that There can be gaps between your restoration and your tooth structure, which lead to micro leakage. But of course, we mentioned its ability to undergo tarnish, which should aid in sealing off this micro leakage, right? And generally, I found three things interesting about the properties of amalgam. It has high compressive strength but low tensile strength, and this combination makes it brittle, so it breaks off, which is why during cavity prep it has a curvaceous margin of near 90 degrees, right? Galvanism, it undergoes galvanism with other metals, so when it's in contact with the metal with other with, with another metallic restoration such as gold, it can set up a circuit in the mouth, which is usually completed by the saliva in the mouth, and this can give electric shock, which is perceived as pain from the to the patient, and this is called galvanic shocks. These are called galvanic shocks or galvanic pain, and also oral lichen planus. Oral lichen planus is an inflammatory reaction or is an inflammation of the oral mucosa of the mouth, and it's seen in people who have amalgam restoration